Hey everybody, welcome to another episode of Go Fast, Grow Fast, where we talk about being in the weeds of growing companies and revenue. Another exciting guest, Allisa, welcome to the podcast.
Thanks so much. Hi, everyone.
Why don't we dive right in and give us some of your background and what it is that you do.
So I'm one of the 4 founders, and I'm the CEO of NanoDropper. We're a commercial stage medical device company located in Rochester, Minnesota, that is leveraging microvolume delivery technology to improve outcomes and break down adherence barriers in chronic eye disease management. Our flagship product is called the NanoDropper adapter, and it's an adapter for eye drop medication bottles that reduces the volume of the eye drop to something that's better suited for the physiology of the human eye. And by doing this, we make each bottle last 3 times as long, making sure these bottles actually last the entire duration that it's supposed to. And you get all the health benefits of smaller droplets, including less systemic absorption of the medication, as well as local side effects. And since it's a small device, I can actually show you what it looks like. So we have a normal bottle here, and all you have to do is remove the cap and replace it with the NanoDropper adapter. And it comes with its own pop-off cap, friendly for all dexterity levels. And our tip is a nice soft silicone tip, just in case of accidental contact. It's brightly blue against a traditionally what would be a white background of your ceiling. So we call that the bullseye effect. And it reduces the size of the drop to about 1/3 of the original.
That's great. So how does one get into this space? I think you when you started with this company, you were still in school, right?
Yeah. I'm actually a graduating medical student at Mayo Clinic, which is why we're in Rochester. I kind of stumbled upon this problem when I was in the application cycle for med schools, and the title of the article was "Drug Companies Make Eye Drops Too Big and You Pay for the Waste." And it talked about, I know, spicy title, right?
That's great. That's great. I love it.
And the author did not hold back. He went into these 5 class action lawsuits that were about the discrepancy between commercially available eye drops and the volume of each eye drop compared to what was actually indicated when you look at clinical studies. So a lot of people don't know this, but if you've ever put in an eye drop, you know the experience of it making a mess all over your face. And a lot of patients tell us too that they feel like, oh, maybe I missed my eye, it's my fault. But actually, these eye drops can be up to 5 times too big for your eye to even hold. And so, of course, it's going to spill out on your cheeks and worse, drained into your nasal, your sinuses, and absorbed systemically. So the article talked about how this was actually becoming a barrier to care for expensive medication users, specifically glaucoma patients. So glaucoma is an irreversibly blinding disease. It's chronic, meaning once you're on a medication, you're on it for life, and every drop really matters. And these medications can cost up to $600 per bottle. So what happens is patients miss their eye, they run out of their eye drops too quickly, and they'll try and refill. Their insurance company says, no, it's too early for another refill. And so they have to make a choice between paying hundreds of dollars out of pocket or skipping the rest of the month. And because of this adherence barrier, we still continue to see terrible outcomes in glaucoma. And I recently saw an article that said up to 25% of glaucoma patients will experience irreversible blindness in at least one eye at the end of their life. So putting all of that together, I was like, if eye drops are too big and, patients are running out too quickly, why don't we just make the drops smaller? And so that's how NanoDropper was born.
Great. Now you said four founders. That's on the larger side of number of founders. Are they all doctors as well? Do you have different disciplines? How did this come to be?
Yeah, I had no idea that four founders in a founding team was even considered big. But of course now, like looking at all of my colleagues, I'm like, wow, I'm surprised that we have stayed together through this whole time. We're going on year 6 now, and we still like each other.
Wow, wow. You must not talk a lot during the day. What is this? How is that possible?
So I am the only medical student, thankfully. And my other 3 founders really supported me through making both work, developing NanoDropper while I was in school. Elias is our chief operating officer. His background is in mechanical engineering. He's worked for big companies in the past in both medical devices as well as aerospace. He worked at SpaceX for a while. And then Mackenzie is our chief commercial officer. She really bridges the company's internal mission and messaging to the customers and vice versa. Her background is she has her master's in BioE with a focus on tech commercialization. And Jenny is our chief scientific officer. She manages and coordinates with all of the various clinical trial partners that we have. She has her PhD in pharmacology.
So you've got some heavy hitters here in the founding team. You've got the science and figuring out you have a working product. So now comes the part of getting it in people's hands and like getting people to actually use it. I mean, at a very high level, you put the word healthcare onto a company and things just got 10 times harder. So
Yes.
at a very high level, how are you kind of approaching the growth of this company?
Yeah. In the beginning, it was really about making sure that our I's are dotted and our T's are crossed in terms of our quality systems, meeting regulatory requirements. We're a sterile device, so all the validations that came with that. On the commercial side, it's about making sure that the claims that we're making, we're being very deliberate about the claims that we can and cannot make to consumers, creating messaging for the different stakeholders that are on our customers list. For example, our patient-facing material looks very different from our eye care professional facing material and our messaging to even payers. So that's kind of broad sweep on the things that we think about.
Yeah. And so digging into that a little bit more, you have 3 audiences that you really are marketing to, right? You have the providers, you have direct to consumer, and you have the payers. Maybe let's just go one by one and talk about, all right, for providers, what are you doing? Like, how are you getting in front of them?
Yeah. And selling wholesale to clinicians I learned that we should try and not use the word providers. And so I've been trying to say like physicians and optometrists or clinicians. And this was kind of a surprise for us. When we were doing our initial market research, we talked to, of course, glaucoma eye drop users, our potential customers, and we thought that this would be a payer combined with a little bit of direct-to-consumer play. What we didn't anticipate was across the board, patients told us that they just follow what their doctor tells them to do. If it's a new device, unlike millennial consumers and younger, our glaucoma patients aren't going to TikTok to learn about what's the newest in healthcare.
Right.
Yeah. So we were like, okay, well then why don't we talk to the glaucoma specialists? And glaucoma specialists are MDs who did their specialty residency training in ophthalmology and then did another fellowship, a subspecialty in glaucoma care. So after talking to them, we quickly realized that they see this problem in their clinic too. it's patients who feel guilty about not being able to adhere to their medication regimen and their disease is continuing to progress. It's all the heartache that, of course, comes with that as well. And the ophthalmologist not feeling like they're providing good care. The second is administrative burden. When patients run out and insurance won't cover the next refill, the clinic is the first phone call that they make. And so there's a lot of additional time and effort just dealing with the payers to try and get these early refill requests filed. And then the last little bit was that the problem of oversized eye drops also exists for in-clinic eye drops. So during the pandemic, these $20 eye drops that are used to dilate eyes went all the way up to $100 per bottle. And there were drug shortages and all of, the whole 9 yards. So we found our partners really early on with the ophthalmologists. And then we subsequently learned that medical optometry is also a thing. So all of that combined, we started building a network of privately owned ophthalmologists or optometrists owned practices so that we can sell wholesale to them. They get to use it on their in-clinic drops, save thousands of dollars that way, and then do their own patient selection, and they get to take on some of the education burden from us and dispense NanoDroppers to their patients.
So how did you, getting, deep into the weeds there, how did you build that network? How'd you find them to talk to, and then how'd you get them to actually pay attention to you? You just jumping out with a sign and say, hey, talk to me.
In the beginning, we just Googled glaucoma specialists. So something that people might not know is every single subspecialty for physicians, there's an organization that does the board certification. You can find them on just by Googling it. And on their website, you'll actually be able to search for doctors who have that accreditation through the fellowship. So that's another search option. Or you can just Google and see what glaucoma specialists are in the area, which is what we did. And we started just cold emailing and calling them, asking them if they could spare 10 minutes of their time. We're a student team, which was absolute key in trying to understand this problem that's posing an adherence barrier. And really, a lot of doctors will help a lot of teams that are trying to solve adherence barriers or something specific to patient outcomes. So I think finding that alignment was really important, being able to open those first doors. And they ultimately became our first customers once we were able to commercialize.
Yeah, no, that's great insight for people. There's a lot of discussion in the industry that, cold email is dead. It's too saturated. Nobody looks at their email anymore. And that's not true. It's your really crappy cold emails. Yeah, those are dead.
Yeah.
Those are dead, But when you find, to your point, the alignment, they have a pain. They have pains. And if you come in and you say, I understand your pain and we're trying to fix that pain, they're probably going to pay attention to you.
Absolutely. And physicians by default, along their training journey, they learned. The whole mantra is lifelong learners. And so I really do think that if you are positioning your team to really be information gatherers and to want to learn instead of right off the bat trying to sell the idea or the device, I think we had a lot of success in that.
Oh, I think that's a really good insight. And I mean, something that we've seen work with other medical devices is doing something along the lines of what you did. It's Google local results is actually really strong,
Yeah.
if they have a practice. So you can do those searches and you can go scrape the results. So this doesn't have to be a manual process. You can scale it up nationwide pretty easily. And then find have that angle where you're trying to learn, you're trying to help them, you're trying to solve their problem, and you are almost guaranteed to get results. You will find people that are open to having conversations, and
I think so. Yeah.
that's great. So that's kind of how you were kickstarting things. Now that you kind of have a base of providers, are you still doing the same thing, or are you getting more word of mouth now, or how are you approaching it?
We do have a pretty healthy referral network when we look at data for, how folks heard about us. Our biggest bulk of new customers are coming from conferences. So academic and trade show conferences really depends on what customer subsegment. But we have been attending conferences since 2022. Last year was our first full year of trying all the national ones plus some regional ones too. Seeing
Travel
the same
schedule, huh?
faces again. Yeah, really busy travel schedule for almost everyone in the team. But I also did get to go to Hawaii, so
Hey, can't complain too
yeah,
much.
exactly. Um, and for our device, because it's a physical device
Mm,
and we can just bring non-sterile demo units, we have the ophthalmologist and optometrist just try it right there at the booth. And so we do a normal drop on a piece of parafilm so they can see it, and we just put a little food dye in the solution. And then we have them put on the NanoDropper, feel the difference in how to utilize it, and then see the actual size of the new drop. And everyone just goes, wow, when you actually see the size difference. And I think that's been really, really key for us in being able to like do a hands-on demo.
finding to your point, the wow moment that makes it
Yeah,
memorable, that's so key. And you know, it's great that your product is small. It's not like you're setting up a giant imaging machine on a
right.
trade show floor that it costs you $20,000 just to bring it here,
Exactly.
but leveraging that to your advantage and sticking in their memory, that's really smart.
Thanks.
So now you're heavily reliant on these conferences and trade shows, and that's driving a lot of the ophthalmologists and clinicians. And let's talk a little bit about the direct to consumer side. So if
Sure.
you're seeing success, going to these clinicians, why distract yourself with D2C? Why put effort into that
Hmm.
as well?
Yeah, from a pure business standpoint, our direct to consumer sales is the highest cost for us. Having to ship out individual units because we do in house fulfillment, having to field customer calls, all the support that comes is very costly. But we felt that because we are trying to solve an access problem, limiting access also seemed really silly to us.
Yeah.
We encourage patients to go find their local partner clinic that carries NanoDroppers so they can also try it in person before purchasing too and get all of their answers to their questions. But, you know, rural folks, people who live in Alaska and Hawaii, we are probably never going to have the coverage in
Yep.
partner clinics when, coverage for having enough doctors isn't even there. So,
Right.
that was really what we were trying to do, bridge that access gap.
Right. So this was a decision where, you know, it's not that it's not profitable, but it's a lot harder. It's a lot more work. There's a lot more overhead, but
Yeah,
it's in line with your original vision, and you felt you had to.
exactly. And one thing that we didn't anticipate getting in return were the heartfelt letters that we were getting from our customers and the calls that we get from them. Just that direct touch point of like actually hearing from their own words on how much of an impact our little device is making has been such a fuel for our team. So I'm so glad that we did that.
Still together. There's enough reward here to. relieve the pressure a little bit.
Exactly. And learning from the individual stories, we were inspired to actually create the Gift of Vision program that we have, where really, really low income individuals can sign up, and we have a donation once a year where we match those donations to recipients, where we can provide NanoDroppers free of cost as well.
That's really cool with the Vision program. That's great. You're making a dent in the access. But my question there is, how are these consumers actually hearing about you? Are you marketing direct to consumer? Are they hearing about you because of coverage that's happening or because of something with the conferences? Like, why are these people even coming to you in the first place?
I think in the beginning, people were finding us just based on their Google searches for eye drop guides, because there's a whole market of products that help the eye drop user successfully get the drop into their eye. And I think we started showing up in those searches as an alternative. And so we worked on our SEO. We started writing blogs of commonly asked questions. For example, why can I taste my eye drops? That continues to be like the highest performing blog that we have. So generating traffic through those means. And then we did try a few different methods, direct to consumer advertising. And we quickly realized that we can't quite reach these folks because of the average age just being older. The best thing that happened for our DTC sales was a newspaper article that was published about us. And we
Those still
can't replicate
exist?
that. I know. And we can't replicate that because it was an organic article that was written. So we actually paused advertising to our patients for more than a year. And we're starting to kind of go back into that, leveraging Amazon.
Having that organic strategy just kind of bubbling up is really powerful. And no matter how niche your product might feel, it's surprising with the scale of the world. There's a surprising amount of people looking for something related to you, and you should never overlook that.
Absolutely.
So there's one last kind of category, which is the payers, right? And
Yes.
some of our audience are in the healthcare industry and they understand how that works, but there's a big chunk that probably have no idea. So can you maybe explain a little bit about how that system works and how you fit into that?
Yeah, absolutely. And honestly, the more I learn about how the payer system works, the more confused I am. So you're definitely not
That
alone
seems
if it
right.
seems really confusing. It is so convoluted. And even after like true courses that we take as medical students on learning about the payer system, I still feel like I've just scratched the surface. With that said, there's this big thing. I'm sure everybody's heard of it by now, but value-based care that's being driven by CMS, which is the Center for Medicaid and Medicare Services. And it's this idea that traditionally we had a fee-for-service model where you go to the doctor and they get reimbursed and paid by the insurance company per service. And then now they're using these capitated models where after you plug and chug all of these algorithms at different levels, you have a chunk that you're paid to take care of a population of patients or some variant of that. And the goal is to increase the value in our US healthcare system because, as many of the listeners might know, we spend the most out of anyone in the world, but our outcomes really don't match that. And a lot of people talk about value and value add, but there is a true equation when we're talking about value-based care with the capital V. And that's on the numerator, actual patient outcomes multiplied by the experience, or what they call patient experience, divided by the total cost of care. And the idea is that innovation is welcome in this new wave of value-based care if you're increasing the numerator or decreasing the denominator. I hope that all makes sense.
It's the more I have researched into this system myself, the more overwhelmed I have become. It gets very deep very quickly. So how do
Exactly.
you, as a small startup team, like this seems like something the big companies, they can tackle it. They can have a whole team just focused on this kind of stuff. How are you approaching this as a small team?
Yeah. At first, to be honest, we were pretty lost too. We just had this idea that, oh, wait, like if there's 3 parts of the equation and NanoDropper actually is able to improve outcomes, elevate the patient experience, and reduce the total cost of care, this must be the answer, was kind of what we were thinking. Um, and I think we were pretty early in I think we were pretty early adopters in believing that this was the future, because this was back in 2018 when we don't have such a competitive market in the value space. Our approach was information gathering. So we started talking to some payer plans. Back then, we didn't even know the difference between like Medicaid, Medicare versus Medicare Advantage versus what are PBMs. But we kind of put those pieces of the puzzle together kind of on a 50,000 foot view. And we learned that what you have to do in even starting these conversations is you need clinical adoption and you need clinical data. So those were the 2 big ticket items that we knew that we needed to accomplish to even start having conversations. And that's actually what leads us into our current commercialization model of selling B2B2C wholesale to clinics in the DTC model. Is we needed time to collect all of these rigorous RCTs to demonstrate that we can do what we are saying that we're doing. And so our intermediary commercialization model allowed us to bring in a little bit of revenue while satisfying that checkbox of clinical adoption. And we're actually just at the cusp of starting these value-based contracts. We're going to be initiating a pilot with a regional plan coming up this summer. So we're really excited about that. But it took us a while to get that data, the clinical trial data.
Yeah. No, it's everything in healthcare takes a little bit longer than other industries, right? You got to be sure about things.
Right.
And that actually kind of leads into another thing I wanted to ask about, which is, so I find, the more technical your solution is, or the more regulated your industry is, the more important and valuable it becomes to have a strong advisory network or a board of advisors, official or unofficial. How have you approached that? Do you have a bunch of advisors that are helping your team? And if so, how'd you go about building that?
Yeah, we do have a quite robust team of advisors. We do have a board of directors as well. Our advisors are not split as neatly as other healthcare companies where you have your medical advisors and your business advisors. What I was looking for is someone that, I could see myself envisioning becoming someone in the middle, someone who understands the data and makes evidence-based decisions, but is in a business role. So we've been really lucky to have a great network of advisors who really match our founders' passion with their depth of experience. We found our early advisors through student level competitions. A bunch of us were students at the time, so we started going to these competitions. Not only did we learn, the business lingo and how to do financials through all of that, but we found our early adopters and our early advisors too. Another thing was just finding people who tried to solve this problem in the past. It was really easy for us to find those people because we literally had an article that was written
Right.
about this problem and all the people, all the giants in the fields that have tried to solve this problem. So a few of them are actual advisors on our
It's
board.
all the legwork for you. That's a
Exactly.
great advantage.
Yeah, exactly. We truly stand on the shoulders of giants and all of the clinical work that they did.
That's amazing. So that's the building up that advisor network. That's it. It's so helpful, right?
Hmm.
It makes you. It removes that, even if it's just a few of the walls that you might have blindly run into. That's
Hmm.
still a few walls less that you have to bump into as you're blindly building this company.
1,000%. Yeah, we're all first time founders, so we had everything to learn.
Right. Right. And I, it's clear that, with NanoDropper, you haven't dropped out of school and become a full-time founder as the Silicon Valley dream says that you should. So, what's kind of driven that choice to pursue NanoDropper now and to continue pursuing your education at the same time?
That's a great question. And I think, as with many medical students, we've been working for this dream of becoming a physician almost our entire lives. And, the late night studying, even before college, thinking that you're going to be a pre med student in college. I think that was my personal driving motivator to continue to try and do this in parallel. I do want to disclose, though, that after 3.5 years of the 4 years of med school, I actually did take a leave of absence. My school is super supportive, and I'm really grateful that my program even allowed something like this. But I took 2 years off and am rejoining the class of 2024 to graduate.
It's probably a great decision for your own well-being.
Absolutely.
Yeah.
Yeah. I don't know if I could have been a very good CEO or a med student if I had been trying to do both while we were commercializing.
Yeah. Either one of those is more than a full-time job.
Exactly. Yeah. Yeah.
Unfortunately, there's only so many hours in a week, and unless we can change
Right.
the orbit of the Earth, we won't be
Hmm.
changing that anytime soon. So, well,
Yeah.
we're kind of getting near the end here, and one thing I ask everybody is, how are you or are you not using AI in your day to day?
I wish I could be using it more, but for our company, we're just another consumer of AI and ChatGPT and things like that make our lives easier, but we're not integrating AI into our business model or anything like that yet.
Yeah, yeah, and it's healthcare, you have to be a lot more careful with what you're doing with data and
Hmm.
what the output is. So you can't afford a lot of the ways that other companies are kind of being loosey goosey with their use of AI.
Exactly. Yeah.
So the other thing that we always close out with is any recommendations for the audience, books, podcasts, whatever floats your boat.
Great question. I have recently been really appreciating learning from other women founders, especially in the device space, which I think may be the last frontier where it sometimes looks and feels like a boys' club. And so Survi Sarna, I'm sure everyone knows who she is now, but she published a book called Without a Doubt. And she really goes into her personal experience of being a first time founder, being a young founder and a woman founder in the device space. So um, I just found it so inspirational, and I feel like it added fuel to like, oh, like it's totally possible for you to do it the first time too. Um, and then, sorry, what was your second part of the question?
Just any other recommendations? Yeah,
Oh, yeah,
yeah, yeah,
that's really been like the thing that's been at the
yeah.
forefront of just like day to day founder life. And then I don't know if people know about this, but there's a new like webcam on the market. Like right now, it makes it look like I have eye contact on like Zoom or whatever. And it has like a little swivel arm that drops down when you're in a video meeting so that you can be at eye level. So that's been a really cool find.
That's
Um,
great. Do you know the name
yeah.
of that? We can put a link to it
Oh,
in the
yeah. I think
description.
it's called eye contact with like a letter I.
Nice.
Yeah.
All right.
And then my last thing for people who are petite and sit at desks for a long time, it has been a game changer to find a chair that lets you sit cross-legged at your desk.
Nice.
Have you heard of these before?
I have not.
It's been life-changing for me.
Really?
Yeah.
Does it just like not have arms or something? How does that
No
work?
arms, and the seat is like this wide.
Huh.
So you can just like sit cross-legged.
Oh, wow. That's cool.
Yeah.
All right. Yeah. Do you know the name of that?
I don't think it's a
Well,
specific brand. I think
okay.
there's a
Okay.
bunch out there.
All right.
Um, but if you're like me and sit at your desk for 12 plus hours a day sometimes,
Yeah. Yeah.
yeah,
I think
yeah,
a lot of us resonate with that.
exactly.
Well, that's great. Well, thank you for those recommendations. And thank you so much for this conversation. This has been really insightful. And we really got into the weeds of how this stuff works. And especially in the early days, how finding those customers and growing from there. I think it's very valuable information for people.
Yeah, I hope it was helpful. And thank you so much for having me.
Yeah, it's my pleasure. Any last words you want to share with the audience?
I guess if you are in this space and want to connect, our website is nanodropper.com. And our general email that you can reach me at is info@nanodropper.com.
Put all that info in the description and the post, of course. So thank you again, Allisa. I appreciate it. And I hope everybody finds this as fun and insightful as I did.
Thanks so much.